This is Jefferson Close-Up. I'm Carol Celine. My guest today is Dr. Maria Werner-Wasik. Welcome.
Thank you.
You told me when we chatted that you grew up in a small town in Poland. Do you have happy memories of your childhood?
Very much so. It was a town about 100,000 people, the capital of the province. It was a very walkable city, so we would walk everywhere. It has a historic part, historic market. I would walk to school, and when my children hear about it, they're envious. They say, "Oh, I always wanted to walk to school rather than be bused," but I guess it cannot be recreated.
Do you go back to visit?
I go back at least once a year, sometimes twice a year. In fact, I'm going tomorrow for a visit.
And do you have a family home or property that you go to?
My mother lives there for most of the year, and I have plenty of cousins and friends. So.
What brought you to the United States?
My husband came to do a postdoctoral fellowship in research, medical research. He's a physician also, and I followed. And then I did my postgraduate training in the US.
What do you consider your greatest achievement?
I came here to be a professional, and I appreciate very much that this is a merit-based society, and I was accepted in this culture, so that's great. I'm proud of all my professional awards, such as Top Doctor in America, America's Top Doctor for Cancer, and Philadelphia Magazine Top Doc.
Very impressive. And if you were not a doctor, and I know you love being a doctor, what other careers might you have pursued?
I have two answers which sound funny, but they're really truthful. I wanted to be a meteorologist. I love following weather and the natural phenomena. I briefly toyed with the idea of being a myrmecologist. That's a zoologist who studies ants and their behavior.
Wow, now that is one I have never heard before. But instead you are a radiation oncologist. And
right.
Your specialty is lung cancer and brain tumors. What do you like most about your work?
Interacting with patients. I like technology. I like that we can bring fairly immediate results. Most patients, practically all we treat, get some improvement. Many are cured of their diseases, and that's very rewarding to watch.
Now, when they come to you, though, they're probably pretty ill. What kinds of things do you tell them? How do you try to manage their concerns?
We have a whole spectrum of patients, from very sick to apparently looking and feeling normal. I always try to be upbeat and present the positives in their situation, to smile, to assure them that we are always there for them. And I think that's helpful for most people.
Is there a particular philosophy here at Jefferson around radiation oncology?
We pride ourselves on being very, I hope, face-to-face and personal, giving personal attention, sort of boutique care rather than big impersonal, which may happen in larger institutions.
Well, that's very good to hear, that you have a big institution, but you take an intimate approach to things. It's been nice chatting with you.
Thank you for having me. It's my pleasure.